Hello YouTube, this is Andrew Tai and I'm here to give you my experience of the third week of post-op from my double jaw surgery. I'm feeling a lot better since last week when I made my last video. I already feel like my jaws have much more range in movement now, so I can do things like open my mouth kind of halfway, and then I can move my jaws around a little bit. It's not painful, and my swelling has reduced a little bit. It's really hard to tell in pictures, but if I put them side to side, then it gets a little bit more obvious. So I'll get a bit closer to the camera and show you my face on the sides. So, the swelling here feels much more reduced. I'm still bruised here, it's a little bit yellow, and on the side here too. And I still feel the majority of the swelling under my eyes here. But I think it feels like it's reduced. It feels very tingly and numb still, but compared to last week, there's a lot more feeling in this area here. So if I can touch my face a little bit here, then I can feel here where I couldn't feel before, and a lot of my chin here I'm regaining the sensation for, but it's really just this part here which still is almost completely numb, but it's quite a small spot, and it's something the orthodontists have said because the nerves in this jaw are stretched a little as part of the operation. Numbness is expected in this area, and in a small percentage of cases, around 10%, this damage here is permanent. So I'm going to keep my eye out for that. I hope it's not permanent, because I've already felt several times this week a little bit of food dribbling down here, and I've not noticed it at all. Someone's had to point it out to me, and so I wouldn't like that to be something that I'd have to live with for the rest of my life, but I expect it to come back within a few months' time. Several of my stitches have already dropped out of my mouth, but I can still see a few, like most prominently at the top here. You might be able to see a stitch there, and also in the bottom corners here, there's still stitches in the mouth, and they should dissolve eventually, but and they're not causing me any bother at the moment. I'm just making sure that the areas are all cleaned out correctly. But it's still kind of freaky thinking about where the stitches are. I mean, there are stitches everywhere and metal plates in parts of my face, which I don't really like to think about, but they are there. Last time I forgot to mention that the orthodontist decided to take my elastics out after my first week appointment, which I had on day 8. I had a clip where I showed the orthodontist that I had movement in my upper jaw. I'll play a clip of that. So there's slight movement if I push my tongue against my upper jaw, the maxilla, hard enough. There's a little bit of movement. So it was much more pronounced 2 weeks ago, and the orthodontist decided to tell me to stop using the elastics, which were bringing my jaws together, because they wanted the upper maxilla jaw to heal faster. So I haven't been wearing elastics for the last 2 weeks, which is kind of a relief, because especially in the first week, getting elastics in and out of the teeth using these kind of pliers to pull them out, and was very painful, because all my lips were swollen, and it really hurt to do. And so I was really glad when the orthodontist told me I didn't need to do it anymore. But I'm having my second appointment next week, and I fully expect that they'll ask me to start wearing the elastics again, because my upper jaw is nearly completely healed now. Overall, in terms of eating, I've been a little bit more adventurous with food lately. I've been eating slightly more challenging foods, like dumplings and rice dishes, and some things that I couldn't eat the week before, and I haven't had any substantial issues with that yet. I haven't choked on anything or been able to not eat anything. I did try to eat a slice of apple once with the skin still on, and that was a mistake. I shouldn't have done that because obviously I couldn't chew the skin, so it kind of didn't feel very good going down. I had to kind of spit it out. But I'm still eating mostly soft foods. I can chew very, very slightly. So if I've got overcooked noodles or pasta, then I can kind of get through it quite easily now. And yeah, I've been quite happy reintroducing some of my favourite foods. I went to dim sum properly this Sunday and had like a normal portion, a similar portion to what I would have had before, and being able to eat things like tasabao and custard buns and things like that. I was able to chew through those kind of soft breads with a bit more ease than I did before. When I did go to dim sum on Sunday, I went with a bunch of friends. There were about 16 of us there in total, and got a quite interesting reaction from people I hadn't seen for a long time. A lot of people said that they didn't recognise me and I look completely different, and that I need to get a new passport photograph because I wouldn't be able to use my passport because I look like a completely different person. And it's really hard for me to visualize, because I obviously I don't feel very different, and when I look at the mirror, because I've changed so gradually, it's really hard for me to tell what's changed. And it's part of the reason I'm making these videos, is to document myself and how the changes are happening gradually over time. And people seem to think that it's an improvement so far, but I find it hard to believe because my swelling is still so pronounced here, and this part in particular feels very strange, and I hope I don't feel like that in the future. I hope I don't look exactly like this. I hope it's going to look better as the swelling reduces over time. Yeah, so one thing I've been thinking about is getting a new kind of look. I really regret not having a haircut right before my surgery, because my hair was way too long. I've kind of developed a mullet, and it's right before my surgery I was thinking, shouldn't I have a haircut? And now that I'm out of surgery, I don't really feel like seeing I don't really want to see a hairdresser. I don't want to explain to somebody that I've had this surgery and be careful with my face, etc. I've had the same hairdresser for about 15 years now. I've been seeing the same guy in Chinatown, London, and I don't really want to go until my swelling's reduced a bit more, and so I'm kind of stuck with this hairdo for a while. I've also been thinking about getting a new pair of glasses, so I've gone through the process of ordering a pair of new glasses through Glasses Direct, which is an online retailer for glasses. I've done the home trial and everything, because my wife mentioned that because my face shape has changed, that I should get a new pair of glasses that will better complement my face, because my face is kind of used to be very long and prominent with my chin, and now it's kind of receded back a bit and I have a more kind of normal looking face. And so I can't wait to try new glasses and see what I'll look like in the future as well. So overall I feel like I have good stamina, especially compared to last week. In week 2 I slept a lot during the day. I felt like I needed time to recover a lot more than normal. So if I'd go out during the day, then I'd need to sleep in the afternoon. Now I feel a little bit better. I still have an urge to rest quite frequently, but I can feel a noticeable difference in the quantity of time that I can go without resting for, and I can feel myself returning back to normal. So I think in the next few days I'm going to go back. I've started ramping up my freelance workload bit by bit, and I'm getting to a point where I'm going to start working full-time again. Thank you for watching this update video. I hope you found it informative and useful. If you like to see more, please subscribe, and if you like the video, please press like. And thank you very much. See you later.